Hello, everyone. This is Dr. Richard Fleming, and today is Saturday, the 26th of December, 2020. One day after Christmas. Only 364 more days to go. And hopefully by this time next year, we'll be able to actually celebrate the holidays instead of watching our neighbors stay inside and huddle in fear. One of the topics I wanted to go back and touch on with SARS-CoV-2 or COVID-19 is the PCR test. While many people have misquoted the use and the benefits of this test, Mullis never intended this test to be used to determine the extent or severity of disease. Rather, what he developed was a qualitative test in the sense that it doesn't define anything more than the presence or the absence of something. While everybody can argue about how many times or how much time should be allowed to pass during the replication of the viral genome in the PCR test, the presence of a positive test merely tells you that the genetic material and the sequences that are associated with SARS-CoV-2 or COVID-19 are present. It doesn't do anything more than tell you that you have, in fact, been exposed to the virus. Virus particles taken from inside your nose or the back of your throat merely means the virus has been there or is there to some extent. But it will not tell you how severe your infection will be, whether you will be symptomatic, or whether you will end up in the hospital. The ability to define the severity of your problem if you become infected with SARS-CoV-2 requires a quantitative test. And the only test that is currently truly quantitative on the market is FMTVDM. This is the test that I patented after more than a decade of development. In fact, it was roughly 2 decades of patenting, development, and actually getting the patent in. And for the purpose of the studies that we did, it was made available without cost, simply so we could determine how severe the disease was in people that were being hospitalized and measure the treatment effect of a variety of medications to find the treatment answers. For that reason, I've gone ahead and included a couple new books on Amazon or Kindle today that I hope will provide some insight into the differences between qualitative tests like PCR and a quantitative test like FMTVDM. Part one looks at breast cancer, and part two looks at artificial intelligence developed with the patent FMTVDM and its use with coronary artery disease. Because the very types of changes that are seen in cancer are present with the early changes found with COVID 19, we were able to use that method to measure the severity of COVID 19 and then to determine if treatment changed the severity of the disease, either the infection or the inflammatory thrombotic response. It's my hope that you'll have an opportunity to look at these books. They're available either in softcover or by Kindle if you have one of those devices. If you're like me and you're old school, you like to have it on a page in front of you where you can write notes and annotate to your heart's content. But for the meantime, it's important that you realize that the PCR test is an accurate qualitative interpretation of whether you have been exposed to or not the presence of a virus such that it's present in your nose or the back of your throat. The utilization of PC, however, to determine whether vaccines or treatments are effective is not very applicable because the mere presence of a PCR positive or negative test does not tell you whether treatment is successful, and it does not tell you what your outcome will be. I hope you'll stay tuned to the channel as we discuss more topics, and I hope you continue to have a happy holiday season.